Good morning, everybody. This is AKA Heather Joy, and you're on the lifeboat. How is everybody? You know what? I'm having all kinds of issues with the internet this morning, but we're on. But I don't have access to the chat right now, unless let me check. Maybe I do here. Oh, there it is. Okay, cool. All right. Well, good morning, everybody. We've got Dennis and John, and I saw Lemmy, Ethan, Charles McClellan, JT, full of hope. She's here. Photographer, Charlie, and I think, yeah, then Chris. Well, good morning, everybody. It's good to see you here. Before I get started, we do have a few rules. The first one is no politics. This is not a political channel. We don't talk about politics. It's too upsetting. Occasionally Tommy will talk about it, and that's totally up to him. But anyway, the second one, this is not a religious channel. It's fine to offer to pray for someone or to make statements like, I couldn't have found sobriety without my faith. That's fine. But if you get over to the area where you're telling somebody why they're not getting into heaven or that your God is better than theirs, none of that. The third one, please refrain from swearing in the comment section and in the chat. As Tommy always says, if you can't control your mouth, then you can't control your life. And I agree. Anyway, the fourth one is no trolls. There's absolutely no room on this boat for mean people at all. If you get caught being mean, you're going to get kicked off. Banned permanently. So none of that. And then I do have a few requests, just that you exit out of the chat right now and hit that like button. If you haven't subscribed, please subscribe and please share this. We really want to, reach out and get this out to as many people as we can. So yeah, anyway, I want to talk about some of the treatments for pain. This is something I live with, just chronic pain. It's great fun. But because of that, I've learned a lot, and I'm hoping that some of my knowledge will be able to benefit other people. And this is just another. This is like maybe part 2 of probably 5 parts of live streams about pain. But yeah, so we're going to talk about possible treatments today. Pain is not fun. It's it goes hand in hand with depression. When you suddenly find yourself without the ability to do a lot of the things that you are used to doing, and then just being in pain all the time, and not having anything that really gets rid of it, it really can wear on you. And it's just, if you have chronic pain, then you have problems with depression too. And the other problem sorry, I keep knocking this desk around, it bumps the camera. Anyway, what's the other? Boy, I just lost my train of thought. Let's see. Oh, of course. Yes. If you're experiencing pain and that pain isn't relieved, your body just becomes much better at letting you know that it's hurting, and the pain can increase. So trying to find ways to mitigate the pain, to keep it under control, can be really important for people that have got chronic pain. But I'm talking about all kinds of pain today, though, not just something chronic, but acute things that you might end up with from injuries or surgery or dental appointments, things like that. We're just going to talk about it all today. I just want to go over first the most common over-the-counter medications that are available to everybody here in the United States. I didn't have time to look up anything about Europe or England or Australia. They have a lot of the same things. They do have a few things that are different, but mostly, we have most of the same things. Sometimes they're under different names, but today I'm just going to be talking about things that are available here in the United States. Everybody knows. Oh, before I jump into that though, I just discovered something new, and it is a dental anesthetic, and you can use this. It's a, let's see, it's called Exparel. It's Exparel. Exparel. It's the generic name is liposomal bupivacaine, I guess is how you'd say it. But this stuff is a delayed release, or an extended release medication. And so if you have to have your wisdom teeth taken out, or you have dental implants, or a bone graft, or, some kind of oral surgery, this is a really nice option for addicts, because this medication, once it's injected, it will anesthetize for up to 72 hours. I think the longest that they could do that before was 8 hours. And so I was excited to hear about this one. And I have dental implants, and it was a couple of years of pain. It was not fun. And I really wish that my oral surgeon had been completely honest with me about the pain I was going to experience, because it was miserable for a few years before things finally before they finally healed. And I'll tell you too, the implants on the bottom, on your bottom jaw, hurt a great deal more than they do on the top. It's not fun. I really wish that this would have been an option when I had those implants put in, but oh well. Anyway, just remember that one, that there is a medication that will numb you for 72 hours. That's 3 days. Usually that is sufficient time for whatever you had done to heal up enough that you're not going to be in a lot of pain when it wears off, hopefully. So just remember that one. It's called Exparel. That's a good one to remember, especially for us that where our drug of choice is opiates. This was a good one to remember. Anyway, let's go on to over-the-counter medications. And the first one, I'm sure everybody knows this one, acetaminophen. Tylenol would be, a brand name. This is, for the most part, considered about the safest of all the over-counter medications, and it's good for treating mild to moderate pain. This one can ruin your liver if you ingest too much of it. People that end up overdosing on something like a bottle of Vicodin, that's got an opiate along with all that acetaminophen, unless you get your stomach pumped and get charcoal in there to absorb it, if it's metabolized through your body, it's too much, in an overdose situation, and yeah, it'll ruin your liver. And you'll tell you what, people that are in liver failure are miserable people. It's not fun. So, this is one that you do need to make sure you don't take too much of. The maximum dose, I believe, is up to 3,000 milligrams a day. They come in, usually they come in 325s and 500 milligrams. And so the maximum dose that you would take would be, 1,000 at a time. And I've noticed when I went through nursing school, they changed the dosage of acetaminophen a little bit since I first went through nursing school. It used to be that you could have 1,000 milligrams every 4 hours, and now it's bumped up to every 6 hours, up to sometimes 8 hours. But I thought that was interesting. But this one is one that you can take on an empty stomach. It's not going to hurt your stomach. This is one that you can give to your children and even infants when they need it. But that's a pretty good one. I remember when it first came out, when I was young. I don't think it came out till I was 11 or 12. And before that, all we had was aspirin that I can remember. And I remember it was a big deal when Tylenol first came out. But anyway, the next one on my list is in a category called NSAIDs, NSAID. It stands for non-steroidal anti-inflammatory drugs. And ibuprofen is one of those. And ibuprofen, again, is for probably mild to moderate pain. It's an anti-inflammatory. So one of the culprits behind pain signals is inflammation. When you have inflammation in that area, that gets the nerves that detect pain, that gets them jumping and telling your brain that you're hurting. So this is a good one. It interrupts the process of inflammation, and it stops the pain for a little while. And this is a really good one, like I said, for pain. This is good for fever too. Menstrual cramps, joint pain, muscle pain, arthritis pain. It's good for all of those. And this one has changed too since I was in nursing school. They've just changed the times, I've noticed, and the dosages a little bit. But for the most part, you can take about, let's see, what am I thinking? 200. Okay, you can take 800 milligrams at a time of this one, and it usually lasts about 6 to 8 hours. This one, you don't want to have, let's see, more than 1,200 milligrams a day of ibuprofen. And it really is something that you only want to take for, I believe, up to 8 days, if I remember correctly, because you will start to get some side effects from it. Also, if you are someone who has got kidney failure or kidney injuries, kidney issues of some kind, this is not a good medication, because your kidneys help clear that out. This one too, some of those other side effects, for some people it makes them sleepy or dizzy. I've seen it do that to my sister. But it's also one that can really upset your stomach and give you heartburn. So if you take this, you need to eat something before, because it will upset your stomach. I have seen some studies, some long-term people that have been on ibuprofen long-term, and it actually ends up destroying joints in the end if you take it long-term. It's really, that's one of the things that has changed since I first went through nursing school, is it's one that you don't want to take all the time. It's really good for acute pain, if you get an injury or something, but for chronic pain, it's not one that you can take every single day. The next one, then this one is my favorite one, and this is also a non-steroidal anti-inflammatory, and it's naproxen sodium. The brand name would be like Aleve. This one I really like because it lasts for 12 hours, and it's an anti-inflammatory. Just like with ibuprofen, you want to eat something because it can upset your stomach. And it is contraindicated if you've got some kind of kidney disease. And this one, you don't want to exceed 1,500 milligrams in a day. But this is a good one, and I really like it. It's strong. I believe it is the strongest over-the-counter pain medication you can get here in the United States, and it's just a good one. It's strong, and it lasts for up to 12 hours, which is really nice. That's one of my favorites. I can't take it every day, but I do take it occasionally. The next one on my list is basically Alka-Seltzer. It's a combination of aspirin, citric acid, and sodium bicarbonate. And this is a really good one if you've got an upset stomach and a headache, because that's going to take care of all of them. But this is, because it's got aspirin in it, this is one that you don't want to take if you are 18 or below. It's really not for children. They have discovered that aspirin, when given to children when they're experiencing flu, and I don't remember what else, but there's the possibility of getting Rye syndrome from it. And so you don't want, yeah, if just don't give it to kids. um, but that's a good one. I remember this one from when I was just a little kid. We always had Alka-Seltzer in the cupboard, and we always had aspirin too, which is the next one. Just regular old aspirin. And this is a good one, for pain and for fever. It is an NSAID, so it's an anti-inflammatory. But it does thin your blood. So, if you people that have heart disease, very often their physician will put the patient on aspirin as a blood thinner, just a little baby aspirin every day, because it does, thin your blood and prevent blood clots. So if you are already taking like warfarin, Coumadin, something like that, then you probably want to steer away from aspirin. But this is always a good one, for just general, a headache or a sprain your ankle, things like that. It is a good one, but just keep in mind that there is a risk of internal bleeding with this one. I have seen patients that, were in so much pain and they didn't realize it and took way too much aspirin, and they were bleeding from their stomach because of it. So, it's one you have to be careful with. But those are the most common, over-the-counter medications for pain. I want to touch on too. I looked up, what are the most common opiates and opioids, because these do, even though, like Tommy always says, and I totally agree with him on this, that this channel is an anti-addiction channel. It's not an anti-drug channel. And opiates and opioids definitely have a place in medicine. I mean, they really can benefit us. And, even though that is my drug of choice, there have been times where I've had to, a couple of years ago, I was in the hospital. I had a bowel obstruction, and those are really painful. And they were giving me morphine every 2 hours. And I mean, I was so miserable that I wasn't even going to argue with them. I just let them give it to me. And, and I never did have a problem after that. I didn't have cravings or anything like that. I was really surprised. But, there are times when you do need these, even if it is your drug of choice, if it's not going to throw you back into active addiction. Some people can manage it and some can't, and that's totally, a personal thing. But, I really do believe these have a place. And some of the most common ones, first of all, would be codeine. You would find this like in Tylenol 3s. Let's see, that there's Tylenol 2s that have, I believe they're 15 milligrams. Those are more for children a lot of the time. I remember my daughter, they gave that to my daughter when she broke her arm and she had to have it pinned. And let's see, but anyway, you'll find, codeine you'll find in like Tylenol 2s, Tylenol 3s, Tylenol 4s. They'll also put it in cough medicine. Codeine and hydrocodone, which is in like Vicodin, or what is the other name? Norco. Those two drugs are very good for treating cough. And from my experience as a nurse, they are really, hydrocodone and codeine are the only things that really truly do take care of a cough, as if you're looking at, medications. But let's see, yeah, they'll put it in cough medicines, and put some kind of antihistamine like promethazine in it. Trying to remember what was the other one? Atarax, I believe sometimes they combine that, but it's sometimes it's same cold medicines, but prescription cold medicines. Let's see, but I was talking about hydrocodone. That would be a combination drug where they have, I've seen it both, where they have a combination of acetaminophen and the hydrocodone, or ibuprofen and hydrocodone. But this is, a good one. It is for treating kind of moderate to severe pain. It's good for that. Pain and cough, yeah. But I'm sure everybody's familiar with like Vicodin or Norco. It's a common one. If you have some kind of big dental procedure, or some kind of small surgical procedure, something like that. That's a common one given after surgery and things like that. The next one on my list is oxycodone. And you guys will all know this one, Oxycontin. That's a form of it. Percocets or Oxycontin are the most common, and they are usually combined again with acetaminophen and the oxycodone. And there's different different strengths of it, but it's a very common one as well. And we all know what the Sackler family did with the Oxycontin to the United States, unfortunately, and darn it. But it is a good one, for post-surgical pain, things like that. And again, it's for moderate to severe pain. It treats. The next one on my list is oxymorphone, and this is one that I have never given when I was working in the hospital. We didn't, in the narcotic drawer. This was one that was never in there. I'm not sure why, but the name brand for this one would be Opana. And it is, again, for it's from moderate to severe pain. It treats, and it comes in injectable forms, in oral liquid forms, in pill form. But it is a good one. And I believe it's usually used for cancer pain, post-surgical pain, severe chronic pain. It can be used for that. The next one I've got here is morphine, and everybody knows morphine. I've always known it as MS, morphine sulfate. Some of the other names for that one would be, in pill form, it would be MS Contin, which is a continuous release of morphine in oral form. Avinza or Acadian are other names for this one. But it comes in liquid, like an oral liquid or a pill form, or injectable, where you can get it in your IV or right into your muscle. But it's, again, another one that is good for moderate to severe pain. This one doesn't last as long as some of the others. It's one that has to be administered, every 2 to 4 hours when you're in the hospital with this one. But it is a good one. They are all very useful when they're needed. And then, of course, we got fentanyl on here. And I'm talking about the medical grade fentanyl, not the illicit stuff that's on the street. The medical grade fentanyl lasts quite a bit longer. Some of the names of this one would be Duragesic. What was the other one? I don't even remember. But this one comes in several forms too, and this one is for severe pain. It's about 50 times stronger than heroin, and it's 100 times stronger than morphine sulfate. It is a strong one, and it is for severe pain. The one the way that I've either ever given it to people as a nurse, giving it to patients, that was either just right into an IV, or it was on a patch, transdermal patch. And I think those are amazing. Those little patches, for people that need this stuff, that's awesome, because you just put that on, and for 72 hours, you've got some good pain control. And I know this is a really good option for people with severe chronic pain, because it's one that you can have that patch on constantly. And then if you have breakthrough pain, pain that comes out on top of that, then you can take something else to try to keep it under control. But it is a good one, as far as, if it's the medical grade, hydromorphone. This one is a very strong one too. This is a good one because it has a very rapid onset. This one, most people know it as Dilaudid, or let's see, Exalgo is another name for it. I've always ever just known it as Dilaudid, but it's a good one for post-surgical pain. But it's a strong one, and it does have a rapid onset, and it is 2 to 8 times stronger than morphine. And then I've got, let's see, this one I was not familiar with. I had to read about it. It's called tapentadol. And this one's interesting because it is a synthetic opioid, but it also uses, what was it? It has a mechanism of action where it reuptakes noradrenaline at the synapses of neurons where you have those mu receptors. And this one, I guess it's kind of comparable to tramadol. If you know what tramadol is, that's just I believe that one only comes in an oral form, and it would be like Ultram, I believe is another name for it. But it's a synthetic one. Conzip is another name for it. And this one would be for mild to severe pain. But the tapentadol is very similar to tramadol, but because of the mechanism of action where it reuptakes norepinephrine, it's much stronger than tramadol. And this one is very good for patients that are diabetic and they have the neuropathy in their feet, that nerve pain in their feet. It's extremely painful. And this is a very good one for that kind of pain when a patient, when a diabetic is very advanced in their disease and they have a lot of that nerve damage in their feet. This is a very good one. Let's see. The other one that I have here, of course, is methadone, which we all know is something that you use when you're to take care of the withdrawal symptoms when you are detoxing from opiates. This is a very long-acting one, and it really is. It's a great painkiller. It's completely synthetic, and I believe it can last up to 24 hours. So for people that have, chronic severe pain, this is a very good one for treating that. But it is quite a heavy drug. It really is. And once you get started on this one is a very difficult one to get off of. But, as for, if you are using it to take care of, the opiate withdrawal symptoms, really good for that. Or if you have some serious pain, that's a good one too. But those are just kind of the most common pain meds that are, opiates or opioids. And I just wanted to go over the side effects. I'm sure you guys are quite familiar, but I just want to make sure, any of these that are narcotics, you're going to, if you take it over time, you're going to build a tolerance. So to get the same amount of pain relief, it's going to require more and more. And there's a definite risk of becoming dependent on it and even abusing it. All of these, there's that potential risk there. If you are taking an opiate or an opioid long term, you do become your sensitivity to pain increases. I'm not sure why, but I know that happens. Constipation is another big problem with any opiate or opioid. Of course, getting sleepy, feeling dizzy, confusion, depression even. Those are problems. And also, if this is something that you have to take long term, it tends to bottom out your testosterone levels. And both men and women have testosterone. And so people that, that are taking these long-term often experience some sort of sexual dysfunction because you lose your sex drive. If you're taking this long-term, it can be quite a problem. And then itching and sweating are also side effects of these. But as I was saying, for a lot of us, being addicts, opioids and opiates are something we need to steer clear of, if that's possible, just because of the potential for abuse with them. But there's some amazing new things that they have discovered with other medications, and using the medications off label to treat pain. And the first one I wanted to talk about would be let's see, SNRIs. It's serotonin. I can't remember. Good grief. They're selective serotonin reuptake inhibitors, anyway. But drugs like Effexor, venlafaxine, I believe, is the generic name for that one. Desvenlafaxine, that's actually the one I'm currently on right now. It's known as Pristiq. Duloxetine, with the other name of Cymbalta, and then another one. Let's see, it's called Savea or Savella. I'm not sure which, but let's see, it's milnacipran. I can never say that for some reason. But all of these are antidepressants, but they have discovered that they, in many patients, decrease their pain levels, if they've got chronic pain. And so, I've taken every single one of these because of depression, and with the hope that it's going to do something for the chronic pain that I have. And I really have never felt any, I have never received any help as far as pain relief from these, but I do know that they do help quite a few patients with chronic pain. And then as far as the SSRIs, Paxil and Prozac, that would be paroxetine or fluoxetine. Those are also have shown to decrease pain levels too. So it's good to have, options. And that's why I'm talking about these, because, if you end up with, a diagnosis of chronic pain, these are definitely ones you want to remember and look into. There are two others, and gabapentin is an anticonvulsant and like an anti-epileptic drug. That's what it was originally used for, but now they use it for all kinds of off-label things. And the first time I was ever given this drug was, good grief, I think I was 21 when I first started going to a psychiatrist, and I was given the diagnosis of being bipolar, which I'm not, but he was giving me this Neurontin way back then. That was a long time ago, but now that they have discovered this is good for treating pain in some patients, and this is one that that they give people that have nerve pain and fibromyalgia, which is, I've got both, and it helps. It doesn't help a lot, but I'm finding that I tried to go completely off of it, and I can't. This gabapentin is one that if you have taken it over a long time, you are dependent on it, and you will go through withdrawal symptoms when you quit taking it. And they're very, very similar to what you would go through with opiate withdrawals. But for some people, it's a miracle drug. It really can take care of their pain. I don't get a whole lot of help from it, but I do notice it does do a little bit. And it's probably it's probably the fact that for a very long time, for decades, I was abusing prescription pain pills. So that's probably just messed my receptors. Yeah, it takes a lot to impress the mu receptors or any other receptors in my body. So it doesn't help me as much, but there's also another one called Lyrica, or what is it? Pregabalin is the generic name. And I have tried this one. When I was diagnosed with fibromyalgia in 2017, I tried a bunch of different things, and I tried this one. It was, it's like gabapentin in that it's an anticonvulsant, but it's really good for treating nerve pain like with fibromyalgia, or nerve pain from a spinal cord injury, the nerve pain that you get if you break out with shingles. That's good for all of those. But I hated it. I don't know why. I've always, my drug of choice was always prescription narcotics. But this one made me feel so completely drugged. I hated it. And I could not wait to get it out of my system. I took it for a week and I thought, you know what, I thought, maybe I'll just get used to it. But it was so heavy, and I felt so weighted down. It was like somebody put weights down on my body. I did not like this. I could not wait for it to get out of my system. And I hope I never get bad enough that I ever need to go back to it, because it was just so heavy. But there are, with both Lyrica and Neurontin or gabapentin, both of those, there is the potential for abuse with them. I understand that people will, take a large quantity of either of these drugs at once because of the effects. But again, I've never tried it, but I doubt it would do anything for me, as far as getting high the way it can do some people. But anyway, those are two more options that you have, for chronic pain. Let's see. Okay, I want to jump into right now. There are so many different kinds of supplements and herbs and herbal combinations that you can take. And I mean, there's an endless amount of them, but I'll just tell you what I am familiar with right now. The first one that I have always found out that helps pain is make sure that your electrolytes are good, that that your potassium and your sodium and your calcium and your bicarbonate, all of the electrolytes that are in your body, if they're off, you're gonna be achy and a little bit miserable. And I have discovered, it's probably just because I run all the time, but if I sweat too much, and I always take salt capsules before I go on a run, but sometimes you sweat too much and you burn it all out, whatever. I'll find that I'll just be so achy and miserable, and then I'll remember, oh wait, go take some salt, and I'll feel so much better. And if you've got heart condition, or something going on with your kidneys that you can't have or your blood pressure where you can't have a lot of salt, then I wouldn't try that. But if you've been sweating a lot during the summer day, you've been working all day and you've been sweating and you're just miserable and achy, I would seriously try taking a little, drink a little bit of salt water, because most likely you're going to feel better. So that'd be my first one. Now, when I was first diagnosed with fibromyalgia, the first thing that my PA did is he sent me to the health food store. And we tried to, I loved that he knew, what to recommend other than just prescriptions. And the first thing that I started on was magnesium and malic acid. Was it malic acid? Yeah, malic acid. I don't know why I can't think of the other name. But this is just it's a very common fruit acid, but it works synergistically somehow with magnesium, and that can help get your pain levels down a little bit. Another one of my favorites is curcumin, and curcumin is the active ingredient in turmeric that is an anti-inflammatory, and if you can get rid of inflammation, you're going to get rid of a lot of pain. And this one I find at my health food store, there's a brand called Terry Naturally, and they have a bunch of different formulas, but the curcumin is the main ingredient, but they have some that have boswellia, which is an anti-inflammatory, and ashwagandha and the curcumin. They've got different formulas. There's even one for really acute pain. There's one for just, aches and pains every day. There's one for backaches. They have some very specific formulas, but I really like the Terry Naturally, because if it doesn't work, you get your money back on this one. And they're very serious about it. They have put so much time and study, so much lab work into coming up with these formulas that have curcumin in them. This Terry Naturally brand, that they're confident that if it doesn't work for you, they will give you your money back. I mean, and there are some people that just don't get a response from the curcumin at all. And so it's not going to help everybody, but I know it works so well for me. It's one of my favorite ones. It is a bit pricey, and so unfortunately I've been going without it for probably about 6 months now. It is a little bit pricey. I only get it now if I'm traveling and I have to sit still for a long time, but that's a good one. Cherry juice extract is another anti-inflammatory one, and this one is really good for arthritis and joint pain. And again, something that you can find at the health food store. You can buy it like on Vitacost, Amazon, websites like that. But it's a very good one. It's just one that if you are diabetic, you probably don't want to be drinking any extra sugar. Now, Johnny Scoville will love this one, capsaicin. Both internally and externally is a wonderful one. There's been a lot of studies that just came out recently that have shown that if you have a capsaicin cream or salve of some kind, and you are rubbing that, say, you rub it into your neck or your shoulders or something, if you do it consistently, several times a day over a few weeks, it really will start to decrease your pain by about half, is what the studies are saying. But you can also eat a bunch of hot stuff, and the endorphin release will take care of your pain through the day. So it's an amazing one. I really like that one. And I have found the capsaicin in different creams and ointments in combination with other things. I've even had it in those little transdermal patches, those pain patches that you can just slap on, your joints or your neck or wherever. And this one definitely helps. Definitely helps. Another one, and this is another one of my favorite ones, are the fish oil, your omega-3s. If you're taking, your omega-3s every day consistently, it will decrease your inflammation. And you can tell a difference if you've been taking it for a couple of months and you run out and you forget to go get more, which I do sometimes. I will notice a difference, definite difference. Another one that is really good is collagen. This one is really good for improving your joint pain, and it also decreases muscle soreness. And it also works really well if you like throw some collagen powder in with some whey protein and make a protein shake. Those are just really good for mostly joint pain and muscle soreness, but it's not anti-inflammatory, but it still will help. Next one on my list, let's see, is chondroitin and glucosamine. These, those are really, really good for joint pain. The chondroitin really helps improve the function of your joints. If you've got arthritis, you're not going to have the range of motion. You're not going to be able to use a joint, as much as you would like to, or as much as you're used to. But the chondroitin will help the function, and then the glucosamine, and you can get these usually formulated together. But the glucosamine will improve the stiffness, and those together they kind of keep your joints lubricated, and just they just work better. They do. They really help. Another one that is really good is MSM, and I, for the life of me, can't remember right now the whole long word, but this is it's a source of sulfur, and it is kind of one of the building blocks that your body needs for making amino acids, proteins, and this is really helpful in trying to maintain your joints, your cartilage in your joints, things like that. It's a really good one for that. Another one that is a really good anti-inflammatory, it is good for pain and for inflammation, is boswellia. And this one is, what country? I believe it's Indian. It's Indian frankincense. I think that's what it is. But this one I have seen boswellia put in combination with things like I was just talking about the curcumin. I've seen it that way, but I've also seen it in rubs and creams and things like that, where you can, where it can be absorbed into your skin. But this is a wonderful one too, it's an good anti-inflammatory. Let's see here. So let's see. Okay. Another one. Some of my other favorites are CBD, CBG. G is in Greg, and CBN, along with THC. At night I usually take some form of cannabis. Because it helps, helps with my pain. It helps me sleep. I honestly don't think that it decreases my pain levels, but I notice that I experience pain differently, and it's easier to deal with. I don't know. That's my personal experience with it. But I've also found out, that if I can sleep at night, my pain levels just go down, because it's just easier to deal with chronic pain if you are well rested, for one thing, and you just feel, generally better if you're well rested. And so this is, I am very, very grateful that Utah has a medical marijuana program, because I do have my card, but I've also can purchase Delta 8 gummies at the vape shop here, which is, it's Delta 8 is a form of THC, and it can help with nausea and pain and sleep, all of those things. It's not the full component that you would have in something that you're going to pick up from a dispensary. But again, I'm really grateful that Utah has legalized, the Delta 8. It's very nice to have around. But what I really like is when I can take something that's got the THC, the CBN, because CBN is really good for sleep, the CBG, and the CBD and the CBG. If I can, sometimes you can get what is it, like a tincture or a bottle of oil, where you just put some under your tongue. But I love it when all of these are together, because the CBG especially is very anti-inflammatory. And if you can get that into your system every day for a couple of weeks, you will really start to notice that your pain levels go down. CBG was a very good one. But CBD, I know for a lot of people, they will try it and not find any benefit from it, and just, never take it again. CBD is something that you have to take consistently every day if you want it to be effective. And, sometimes it can be a little pricey. So that's, yes, it's not accessible to everybody. And I wish it wasn't so darn expensive. But if you can find something that's got the CBD, the CBG, and the CBN in it, you're definitely going to have benefits. And the CBD, the D, the G, and the N, those don't have psychoactive effects, and you can purchase them, without the THC in them as well. But those are all really good, really good stuff. I'm talking about taking it internally, but you can also put it, you can purchase, what is that brand? Mary's Medicinals, out of Colorado. does these little pain patches that have, you can get just a straight CBN or a straight CBG or just a straight CBD, but then they also put them all together too, with the THC. And those pain patches are awesome. They'll last for, good grief, 10 hours maybe. I'm trying to remember. But anyway, it's a good option when, if you need it. Let's see. Also, I've got, what, good grief. I'm going to have to do a part 2 just on this one. I've still got so much more to give you guys. And I was going to tell you guys as well that I'm going to be putting all this information. I'm going to just make some handout sheets or something that, so if you guys want all of this information or parts of this information, email me. And as soon as I get this all put together, I can just send this list to everybody. And if there is something that you guys use that works well that I don't mention, please let me know about it, because that's what I want, is just to, be able to give people options. Yeah, I've got this box right here on my desk that is full of topical stuff. With my husband and I running all the time, we've always got aches and pains, and we're always hurting. And I've got a plethora of stuff. Oh my goodness. Yeah, I think I'm just gonna stop right there for now. And I guess tomorrow I will go through the rest of this stuff. But I've got a lot more stuff to go through. Mostly it's more lots of different topicals, lots of different herbs and supplements still to go through. I mean, but there's some really good stuff out there. Like I said, please, if there's something that I have missed, that I haven't mentioned yet, please email me about it and let me know. And I know there's somebody on here, I saw in the chat last week, somebody here in the chat makes a Xanadu cream. And unfortunately, I didn't know what that word meant. What that word could mean. Somebody clued me in. But somebody's making a cream, and I believe that they said there was DMS, or is it? I've got it somewhere right here. What is that stuff called? DMSO. Yeah, this stuff stinks. I read all about this stuff and read how it was supposed to be really good for pain. It's a topical thing, and I opened the bottle and I closed it right back up. I'm not going to put something that stinks like that on my skin unless I'm really desperate. So I want to know, does anybody out there, use this DMSO, or it sounds like there's somebody out there that's mixing this with other things to have a really nice topical pain reliever. But I want to know, is this everybody's experience with this stuff that knows what I'm talking about? Is it stinky? Or have I just got a bad jar, or what? I don't know. I won't touch it because I can't stand the smell of it. Anyway, yeah, I guess I've got lots more stuff to go through as far as pain relief. So I will continue on that tomorrow. Anyway, let me see who is in chat. We got Dennis N. Oh, yours has no smell at all. Really? Okay. Dennis, I need to talk to you. I need to buy some of that from you, or figure out how you make it. I would love to buy some from you if you're selling it. Let's see. Anyway, we got Dennis and John and Ajot, or I'm not sure. Let's see. Trish and JT and Luke Skywalker's here. Ladybug. Let's see. John Doe. Who else have we got here? Full of Hope. Missile Smokes is here. JT. I think I already said JT. Anyway. Ethan. Hey, good morning, Ethan. Let's see. Ultra Maga Tea and Random Toaster. Welcome, you guys. Well, welcome. You've been here an hour now. Good morning, I should say. How's that? Let's see. I don't want to miss Anybody? Stand for truth. Hey, how are you? Glad to see you. And, there we go. Scooby is here. Let's see. If I have missed anybody, I apologize. I'm tickled to see all you guys. And of course, Charlie. Oh, and Noise Opera is here. Good morning, Noise Opera. You kind of snuck in there at the beginning, didn't you? Anyway, if I missed you, I apologize. But I'm so tickled that you guys were all came to hang out with me this morning. And like I said, if there's something that I haven't mentioned that works for you, please email me. I think I forgot to put my email this morning in the description box. I'll put it there right now. I don't know if this will work. Let me see. I've been having issues. Let's see. Okay, did that come in 3? You haven't had aspirin in nearly 50 years. Wow. I like it in, I forgot to mention the another one that is one of my favorites for headaches is Excedrin, and that's a combination of aspirin, acetaminophen, and caffeine. And caffeine is really good when you are in pain because it helps take that, it gets into your system more quickly with caffeine. It speeds the uptake of the drug into your system so that it can be effective, start to relieve your pain. And so, if you if you're in a lot of pain, get a can of Coke or something with caffeine, and and drink it with, if you're taking Tylenol or whatever, because it will speed up the uptake. If you're in a lot of pain, that's a good way to do it. Did it come through? Let me see here. I put my email. Okay, yeah, there's my email there. Oh boy, I can't even type either, but you guys get it. Like I said, if you want me to email you all of this information once I get it put together, email me. And again, if there's something that you use that you want to tell me about so I can tell everybody, please let me know. Because, and I'm always looking for new things as well that might help, because it's just, pain is just something I have to deal with, and it's not fun, but it's life, Anyway, so good to see all you guys. If you guys, oh, and James is here. Hey, I missed you. I apologize. Yeah, John says, I knew all this coffee helped. Yep, it really does. Where are you, John? At 96 in the shade today? Ooh, yikes. That's not fun. I'm sorry. That's not fun at all. I hate being hot. Anyway, well, you guys have a great day. If you need help, please, reach out. If you don't have your 5, your list of 5 to reach out to when you are in a crisis, please get that together. We've got the Facebook page, and we're here to help. Reach out, help each other, and honestly, if you help someone else, you get every bit, if not more, out of it as the person that you are helping. Seriously, it is huge. It makes you feel so much better too. So I love you guys. I am praying for all of you. Hey, Trini Humans here. Cool. Hang in there, you guys. Sobriety, you can do this. If I can do this, you can do this. Seriously. So hang in there. You guys have a great day. I will be talking to you again tomorrow. Thanks, you guys.